struggling. We will go to Yemen now to hear from Aziz from Yemen National Radio. Aziz, can you hear us?
Yes, I did. Hi, how are you? Thank you for taking my question. I don't know where to start, but let's talk about Yemen for an instant. What's the plan going there? What's going on? I've reached to the envoy, and it was very hard. Numbers are not correct. Emails are not correct. The page that sourced the information for the citizens actually is written as shopping for motorcycles. So it's such a lot of effort that has been made by the WHO, but it's kind of not realistic for Yemen to have no cases at all, or maybe the Yemenis have some genetics that works for this. So can you tell me more about the plan that is implemented in Yemen, and how is it 27 million, around 27 million, and only 600 tests are available?
Thank you, Aziz. Thank you for the question. Maybe Dr. Ryan has some information about Yemen.
We'll certainly provide more, but Dr. Altaf Buzani is our country representative there. Altaf is a highly experienced public health leader, previously worked in Iraq, and he's working very closely with Lisa Grande, the UN humanitarian coordinator there. Yemen, as you know, and again, my sympathies for the people in every part of Yemen. The population and the people of Yemen have been to hell and back in the last number of years, both in terms of the destruction of health infrastructure, large outbreaks, including cholera, as we've seen over the last number of years. And WHO has been there with our partners, and we have stood with the people of Yemen, wherever they are in Yemen, to provide essential health services, the provider of last resort, trauma and clinical management pathways, mobile clinics, vaccination, and now surveillance and response for COVID-19. I'll have to check the numbers you mentioned to me on the number of tests available. We know we have provided testing capacity, and we continue to work with the government to beef up the capacity to do isolation and to do contact tracing and quarantine of contacts. As I said, I don't have the exact details on the testing you mentioned, but I will most certainly follow up with our country representative, with our regional director, and get back to you on that. But please be assured of WHO's absolute commitment to support the health, safety and welfare of the people of Yemen.